impact of our seniors. Mr. Johnson is recognized.
Thank you, Mr. Chairman. Mr. Wing, Dr. Burnich, and Mr. Book, my district back home includes Collin County, Texas. That's Dallas and Plano. My district is about 24% Medicare beneficiaries, and they have opted out of traditional fee-for-service Medicare and enrolled in Medicare Advantage because there are more advantages, obviously. Since ObamaCare became law, Medicare Advantage enrollment has doubled in our county, yet benefits are expected to be cut over $2,600 per person, and the total number of plans has already begun to decline. And I wonder if each of you can just explain what cuts mean for Medicare beneficiaries in my county and the nation, and if these beneficiaries lose access to their Medicare Advantage plan, what challenge will they face when they have to re-enroll in a fee-for-service Medicare, and is that going to work? Mr. Wing?
If I may, I'll just speak to the SCAN experience, and SCAN is operational in Arizona, Northern California, and Southern California. I don't think the experience in Texas is going to be much different from in California or Arizona for 2015, 16, 17. We're trying to shoot for a small margin, but no margin, no mission. And we're being forced to do things we don't want to do. We're a not-for-profit. Our whole mission is to improve the health and independence of our members. But with the cuts and the changes, we're going to have to, as I mentioned, withdraw from one geographic market, withdraw products, especially the special need products that are probably the most important products of the MA program because they deal with the most frail seniors. But we can't sustain, they're hard for us to sustain in good times. With these cuts, in some geographies, we're going to have to withdraw them. And for our core programs, we are going to have to make some changes, more cost of share participation on the part of the beneficiaries. I think you'll see that in Texas. I think you'll see that across the land.
Thank you. Dr. Burnich.
I think the biggest concern for me is access to care for patients, particularly if they get disenrolled from a Medicare Advantage plan. Fee-for-service Medicare and primary care, it's hard to run a practice off of that. You have to really kind of manage a percentage, if you will, of the patients you will. Those patients, if they get disenrolled from an MA plan, might have trouble getting into a PCP. Not to mention we have a shortage of PCPs. We have an aging population that's growing, so we're really putting pressure on access to care.
Yeah, and don't you see some docs even getting out of the business?
Absolutely.
That's what I'm seeing.
Yeah, I don't think California and Texas are different there.
Yeah. Mr. Book?
I think the impact in the type of impact is going to be the same throughout the country. The individual dollar amount of the impact is going to vary from county to county and state to state. And the reason for that is the benchmark rates are set at the county level, and they're set by in the past they've been set by a somewhat arbitrary formula, and now we're just transitioning to a different somewhat arbitrary formula. So the difference between the old rates and the new rates is going to vary from place to place. So it's going to be much, the counties that are hit worst are in Louisiana, the counties that are hit least are in Montana on average. But it's the types of impacts we're going to see are the same. Everybody is going to see a reduction in benchmarks. Everybody is going to see an increase in out-of-pocket spending and or a reduction in benefits. It's going to happen everywhere. And it's not a, you put up that nice chart of what would have happened if the Affordable Care Act had been implemented, but it wasn't implemented. So, of course, the predictions didn't come true. That's kind of like if you say if you jump off a building, you'll hit the ground, but if you say, well, I'm not going to jump off the building yet, so I'm still fine, you really haven't, that doesn't really mean that it's okay to jump off the building.
I hope we don't go jump off a building. Mr. Chairman, I'm ashamed that this administration decimates Medicare, especially Medicare Advantage, to pay for Obamacare. And while they're playing political games and covering up these cuts until after the election, Medicare beneficiaries in my district and around the nation are losing benefits and access to their preferred Medicare Advantage plan. So I just want to thank you for holding this hearing, and yield back.